Great. So, hi everyone, a very warm welcome. Like we said, a good morning and evening from wherever you're joining us. And today is a very special day. It's the second session of our inaugural launch for the Women in Cardiology initiative at Hridayamrit Foundation. And we have the distinct pleasure of Dr. Anu Lala, who's joining us today to be the host of this session. And she's very kindly agreed to do this for us. So, thank you so much for joining in, Dr. Lala. And this is an exciting session. We have so much to share with all of you. And we'll kick off probably with a little introduction about what we are doing and how this got conceptualized and head over directly to her session. At Hridayamrit, we are a non-profit organization dedicated to transforming cardiovascular health through early career leadership, education, and outreach. And the core mission that we follow at the foundation is, of course, to empower the next generation of medical professionals, which can include anywhere from medical students, early career trainings, residents, fellows, even early career professionals to help bridge that gap in health literacy that we see in countries like India and other comparable LMICs. It's basically something we're doing out of passion and purpose and with the right people for the right cause to promote heart health through prevention, education, and outreach. Going forward, a little bit about how we started and this journey. I think it was very important to have this highlighted in a country like India, where concepts and topics like WIC were probably not known or people were not aware of this. So we've been very, I would say, humbled to be joined with a very extraordinary board, of which Dr. Lala is the founding advisor of. And we were very happy, actually, happy World Heart Health Day to everyone. We actually got our inaugural feature in quite a lot of press briefings today. Okay, I see Sarah here as well. Hi, thanks for joining in.
Hello.
So I think kicking up about the women in cardiology and what we are going to be doing, I'm going to hand it over to Priyansha, who is the project lead for this and also serves as the vice president for our activities board.
Hi, thank you so much, Aman, for such a great introduction to our work and to everything that we have been doing. Thank you so much, Dr. Lala, for agreeing to join us in this cause and helping us promote women heart health in such a great way. To give a quick brief about what Women in Cardiology comprises of what we are aiming for, we are a youth-led effort under Hridayamrit Foundation where we are trying to bridge across the individuals, across all these stages of healthcare in order to contribute towards advancing women's cardiovascular health. Many of you might be aware that cardiovascular disease is a leading cause of mortality among women. However, going through, if you have been part of many working groups or have been part of many projects, you would realize that one of the key gaps that has been observed is not just in awareness, but also in understanding. While many of us might be passionate about this cause and might want to work towards it, there is often a limited clarity on where the real gap lies, and even there are more fewer platforms where we could actively work on them. So that is the whole vision about creating Women in Cardiology and having this initiative where we are trying to foster informed conversations, have inclusive research, and basically create a space where ideas can translate into meaningful changes. We also plan to conduct on field activities where we are trying to find where the real cause lies in our society and kind of work towards advocating and contemplating more research to bring in a change in the future. And today's session is a step in that direction. To give you a quick brief over me, I am also one of the project leads for WIC, along with Amanpreet, who has been so kind to give me this platform and letting me transform this idea into something so meaningful. I have been very passionate about women cardiovascular health, have been part of working groups, and being part of these American working groups kind of gave me a motive to start something like this in India and try to contemplate and trying to translate into what I see in my personal society and what I see in my surroundings in order to bring a change as much as I can as a early health career advisor I am. Just to give a quick overview also about our Heartscape team. So, if you have been following us on social media platforms, you might be getting information on everything we have been posting about women's heart health and where the gap lies and where the research lies and what people have been working towards it and who have been actively contributing to it. And it has all been thanks to this amazing team that we have formed, an amazing team who has been working dedicatedly towards bringing a quick change. So, having a quick brief overview about what we are going to be discussing today, women continue to be underrepresented in clinical trials. And, if you have been following the recent work across various professional guidelines, you would see that there are six specific differences which have been noted where women are still under-recognized even in practice. So, in today's session, we are trying to focus on addressing these gaps in women's cardiovascular health, advancing the conversation around inclusive and sex specific research, and also exploring strategies to integrate this sex specific insights into the day to day clinical practice. And for that, we have our esteemed speaker, Dr. Lala, who will be giving her insights and her way on how we can tackle this challenge. Aman, if you could have the
Yeah,
platform to
thank
introduce
you.
Dr. Lala. All
Thank you
good.
so much, Priyansha. And now we have Dr. Lala in the spotlight. So a warm welcome again. Dr. Lala is serving as the program director for Advanced Heart Failure and Transplant Fellowship and as the director for heart failure research at Mount Sinai, and has been very kind to be helping us in this humble initiative. So I think before we start, I'd like to kind of welcome you, and if you can have two words about what was your vision when you agreed to join us and what your work has been inspired by when it comes to initiatives like this.
Yeah, thank you so much, Amanpreet, and the whole Hridayamrit Foundation. It's nice to see so many of you joining today. My interest was really to take part in this kind of grassroots effort to raise awareness, to build opportunities for individuals who might not otherwise have them. And being an Indian American, I feel like it is our innate responsibility to give back to our community worldwide, whether that's Indian Americans, whether that's Indian Indians, it doesn't really matter. South Asians just broadly. And so I really believe in the democratization of education and opportunities like this for research, for education, for building awareness, for advocacy. And Hridayamrit really represents that kind of ethos. So it's really a true honor and privilege to be a part of this effort.
Thank you so much. That means a lot to all of us who are joining in from the foundation and the volunteering side of it. And I think this is what exactly we need when we are building such a movement, especially in a country like India, where we have people who are so interested and they really want to do a lot of things, but the opportunities stay very limited and only to very few who are actually aware about that. So that's the bridge, that's the gap that we're trying to bridge with the foundation and initiatives like the WIC. Thank you so much. I think we'll start with the initial questions about, I would say, your journey and how you started in this field. And Priyansha can take over that.
Yes, absolutely. So before we deep dive into the research part of it and what the gaps are, we would have to take a step back and reflect your personal journey, Dr. Lala. So my first question would be, what initially inspired you to pursue cardiology, and how did you become interested in the field of research?
Yeah, so thanks so much. Just before I start, I always like to reiterate my intention. My intention today, and hopefully it'll be fulfilled, is to share a little bit of my personal journey um, in an effort to hopefully either inspire someone else, allow them to feel seen and heard in a way that's relatable, um, and also point out this. The spiritual aspect of things, which is, so inherent to our culture. So those are my intentions first and foremost. I think cardiology has always been around me. My father's a cardiologist, so I grew up with it, not as an abstract field, but something that was very real in our everyday conversation and livelihood as a child. My grandmother had a very big influence on me. She visited us when I was in sixth grade, and she actually had an inferior MI after we had pizza one night. She loved pizza. And she was very clear. She was in her 80s, and she told my parents, my father recognized she was having an MI. And she said, I don't want to go to the hospital. I'm visiting from India. I don't want to be in a hospital in America. If I have to go, I have to go. That's fine. So my father said, okay, I'm going to treat you old school style, right? So he went to his office, he brought his EKG machine, he did the EKG machine. Sure enough, we saw, I didn't know that at the time because I was 11 or 12, inferior ST elevations. She was vomiting and her pulse was thready and her blood pressure was low. And he treated her just the way we used to treat heart attacks, with an aspirin, a beta blocker at the time, and morphine, right? And I was in charge of feeling her pulse. I remember him saying, Anu, you keep your hand on her pulse. And I was like, well, what's happening? So I I can even remember where I was sitting in our family room. And so I had the job of keeping my hand on her pulse throughout the night and holding a bucket for when she vomited. So it was very kind of, it was so real in front of my face. And what really stayed with me was that simple task, that pulse, which, I was a child at the time, but perhaps couldn't. I realized that there was something very profound about it. The idea that you can feel life, the rhythm of life, physiology, um, in that one spot. And it was tactile and it was relatable, because then I wanted to feel my pulse. And so there was this understanding on some level that there's a universal energy that was common between us. Um, and that really stayed with me. She survived, she did well, she went on to live for several more years after that, went back to India. But that experience left an indelible impression upon me. And I think over decades, there was something that really struck me about uh, cardiovascular physiology. There's the mechanical aspect of it. Of course, I think the cardiovascular physiology is just fascinating. And it's not just the heart, it's head to toe, it's the cardiovascular system. But it's also so symbolic, right? It sits at the intersection of biology and meaning and purpose. And over time, I became more and more interested in this connection between the mind and the heart, not just metaphorically, but also physiologically, right? If we're anxious, we feel our heart pounding. Similarly, and so they're constantly in conversation with each other. And I wanted to go deeper into that. And so research then was born out of that curiosity. How can we better understand what we experience clinically, but doesn't necessarily fully align with what has been discovered thus far? And that's an ongoing, lifelong passion. But that's a starting point for how I got interested, attracted to cardiology, and why I continue to just love what we do on a day-to-day basis.
Thank you so much, Dr. Lala, and thank you for sharing your personal anecdote. I think I definitely relate to it because even my own grandfather, he was a heart patient, and the main reason why delved into cardiology was because of his admiration that he had for his cardiologist and how he took care of him over the years. And I'm not gonna lie, I was a bit jealous of it because I wanted the same admiration at some point, and I really loved how he used to talk about him. So thank you so much for sharing it. I'm glad that everyone, comes up to this personal anecdote at one point of their life. Amanpreet, would
Oh,
you like to take
absolutely.
the next
Yeah.
question?
Yeah, I'll follow that up. That's a beautiful experience, I think, that you've shared. And that's actually one of the questions that I was having in my mind at the end of the session when you were talking about the integrative well-being aspect of cardiology. And I think uh, unfortunately, a lot of people don't see that. And I think it's just restricted to the mechanical and the physiological ones. But yes, I agree. When you're talking about the heart-mind connection, that the fourth dimension, I think it's real. We cannot really skip it. And I think that's another thing that we would want to do is to kind of, promote that understanding among people as well, that it is true and it exists. But that was really nice to hear. Thank you. Following up, I think the next question was that when you look back at your training, when you started in India, coming to the States, and your entire career, and also I think on a personal level, what has your experience been as a woman in cardiology? The initiative that we've started is Women in Cardiology, so I had to ask you this, but it can have multiple aspects in your life. So, what would some of those ones be that you reflect right now?
Yeah, thanks, Aman. Just for those of you who are on, I was born and raised in the US, but always, grew up in a very culturally rich household. Our family is Sindhi, so there's like a lot of pride and, um, uh, a lot of deep spiritual belief more than ritual belief, just as a note of background. Um, and I also went to a school. I was really fortunate to go to this school as a kid in New Jersey called the Vivekanand Vidyapit. So it's a character building education school that's founded on the principles of Swami Vivekananda. And that had an incredible impact on me. And I share this because I know that wasn't your question, Aman, but I think that has formed much of my attitude. And so when I am asked about my experience as being a woman in cardiology, I think you'll hear very different responses based on who you speak to. Mine has been overwhelmingly positive, because I feel like I've been lucky to not have approached my career from the perspective of being a minority or feeling limited by being a woman. I've been really focused on what can I contribute? What am I going to bring to the table? Clinically, academically, as a part of the larger conversation. And so I fully acknowledge that representation matters. I advocate for representation, not just for equity, but for the kinds of questions that we also ask and the way we approach our care. Um, but my personal experience as being a woman in cardiology has been grounded in opportunity. I feel like I've been incredibly blessed. I've had incredible mentors, both men and women. And I feel really, really lucky for all of the chances that have been afforded to me along the way. That doesn't mean that I'm not aware of the fact that the field continues to evolve and needs more representation of women, needs to ask the right questions of heart disease in women. And I think that that's evolving. I know we're going to talk about this in forthcoming questions, and I think that's a wonderful thing. I don't know if
Right.
that
I
answered your
think,
question.
oh, definitely it did. Because I think whenever we approach somebody with this question about their understanding and experiences with women in cardiology, I think people usually go down the path of disparities and things which are really not positive. So I think this was it was a really good understanding about what you can bring to the table as a woman, as a female in the field, and that contribution I think matters much more. I think everyone has a choice, and the choice is not just in their understanding but also how they practice their medicine and treat their patients. So thank you.
Yeah, absolutely. It's always what can you do rather
Mhm.
than what can, it's sort of that ask not what your country can do for you, but what you can do for your country. I think that's very
Right.
relevant in any circumstance, any community, any organization, your family even, I think the more you focus on what you can do and contribute, the happier you end up being.
Right. And I think this extends to the South Asian population, because if we're talking about, it being a minority and specifically talking about, yes, okay, we come from this background, this culture, that somehow I think brings a little negative perspective along if you think in that direction. Rather than that, if you can do something like, okay, if we are South Asian, what can we do to kind of bridge that gap? How can we do something and bring something to the table? That I think that adds much more value and purpose to what we are doing.
Yeah, amen. Amen.
Great. Priyansha?
Yes, absolutely. Thank you so much for that. And I think I definitely agree with Dr. Anuradha, because I think a lot of us might have that seed of an idea that we want to do something, but they might not be able to know where they could do it
Mhm.
and what change they can bring. So I really hope that this initiative kind of becomes that stem for them to move forward. Moving on to our next question. Looking at how things have changed over time, do you think, Dr. Lala, that you have seen the conversation around women's cardiovascular health evolve within cardiology, in terms of every talk that we have, in terms of how the medical healthcare is kind of contributing to it, how clinicians are talking about it, and how guidelines are being formed towards it?
Yeah, thanks so much. I think it has changed significantly. I think there's much greater awareness now, not only among clinicians, but amongst researchers and even patients. I think we're seeing more recognition that women's cardiovascular disease is not just a one-off or a variation in a disease that affects men, but it is the number one killer of men and women worldwide. But in women, it may have its own patterns, its own timelines, its own drivers. So I think that recognition and awareness is many-fold increased better than it was in prior years and decades. I think there's also more advocacy. I mean, look at us here today, right? There's more dedicated research. There's more intentional focus. You know, I spoke about intention before we started. I think that's so, so important. But at the same time, I would say we're still early in the process. There's a lot we don't fully understand. And many of our current approaches are a little bit of a one-size-fits-all framework. I think these approaches are built on data that were not originally designed to answer sex-specific questions and sex-specific manifestations of disease. So yes, a lot of progress, but also I think a lot of work ahead.
Definitely. I might put you on a quick spot here, but do you have any
Please.
personal experience or any personal anecdote where you were really surprised to find a change that, a talk that on women's cardiovascular health, which you would not have expected in early years, but you were really surprised to see that this is something that is being in conversation right now?
I mean, I think the whole dialogue around perimenopause and menopause worldwide, certainly for sure in the United States and the Western Hemisphere, perhaps more so than the Eastern, is a revolution because we're talking about things that were faux pas. You know, I felt like I grew up in an era where you like would never say that someone had their period. It was like, ugh, like even saying it out loud now, I'm like, oh my goodness, you know. And here we are in an era where, first of all, the newer generation talks very freely about these things, boys, girls, men, women alike. And that's a little bit of a tangent, but I think understanding the transition from a hormonal perspective in the perimenopause and menopause phase of life as an inflection point for seeing increases in chronic disease, namely cardiovascular disease, along the spectrum of cardio-kidney metabolic syndrome, is a complete paradigm shift. And so, you know, while your question was give me a personal anecdote of what surprised you, I think I'm continually surprised. We're building the Center for Health and Wellness for Women at Mount Sinai in New York, and I'm doing an integrative medicine fellowship, which Amanpreet referred to. And so this integrative approach to embracing menopause hormone therapy, to adopting proactive prevention-based care for cardio-kidney metabolic health, and being receptive to integrative approaches like acupuncture, yoga, pranayama. To me, this represents the most exciting intersection of care, of advocacy, of awareness. And I think this is where I'm really excited to contribute to this field and advocate for this kind of truly integrative approach to care, where it's not or, it's and. It's not, okay, only do an Ayurvedic diet and you don't need any of this other stuff. And it's also not only take hormone replacement therapy and a statin, right? It's all of these practices coming together to provide for a more holistic approach to care. And I think the recognition of that is what's both surprising and exciting to me at this time.
Definitely. Thank you so much for sharing that. I think every time we have these sessions, there's always something new that we learn. For example, the integrative approach that we are talking about. And I think it would be really interesting to see how it is being developed and how it is being implemented among more and more
Right.
patients.
Yeah, for sure. I think time will tell. But we're at that
Yeah,
starting point where we're even able to talk about it.
You know,
definitely. I think that's really interesting.
I'm sorry to jump in here, but I think this is amazing. You know, the more I'm thinking about, how should I bring this topic, it's coming in naturally. And I thought I'll keep it for the end of the session to talk about integrative or holistic well-being. But I think I'll just I think the way forward for this webinar is actually go parallelly. I think that would be a good idea. So
Yeah,
before we
sure.
go into the research and the trials part of it, I think you've talked so much about integrative well-being. I remember an incident of mine a couple of years back. I was at a conference, and I've been very interested in this space and for doing something which is actually bridging that gap. But I think there is so much hesitation and reluctance from people in terms of talking or just understanding about this topic. I was having a chat with a very I would say a giant in the field, and I told them about the concept of I'm trying to do something in holistic well-being. He's like, "What do you mean?" I'm like, "Holistic well-being." He's like, "I don't like that, and you can call it integrative, but not holistic. I don't believe are the principles of medicine." And I think that's something which has stayed with me ever since that conversation. And I think one question that comes to mind is that how do you aim to bridge that gap about
Ah,
awareness, understanding, and practice? Because it's something which people are very hesitant to kind of take a dive in.
I think it's a beautiful question, Amanpreet, because we have to be very careful with our words. I
Mhm,
think there are, if you think about it, there is integrative medicine, there's alternative medicine, there's complementary medicine, there's functional medicine, there's Ayurvedic medicine, there's traditional medicine, there's Chinese medicine, there is, you can call it holistic medicine. So, and all of these different terms mean different things to different
mhm,
people. To me, the path forward is defining what is good medicine. And good medicine to me should have some evidence for its use. And certainly the Western world is, and this is what I do, I'm a clinical trialist as well, which is let's garner and gather the information to support a specific approach, therapy, technology, device, etc. Right? In the whatever we want to call it, integrative, holistic, traditional medicine space, let's call it traditional medicine if you want, we have not been able to generate the same level of evidence to support certain approaches to care. Why is that? Well, there are many different reasons. Many times it's that we cannot isolate one particular therapy or therapeutic approach in a reproducible fashion to test its efficacy in a population, right? Um, and that's where I think we need to figure it out. Because we can say, the counter argument to that is, oh, but you can't test holistic medicine. This is so individualized, it's so personalized. How each person receives it is different, which I agree. I think that is true. But we have to find a way to collect data at least to be able to speak to how it allowed for improvement in certain populations. I don't think anyone will deny that there is a connection between the mind and the heart, or the mind and the body, right? Okay, so how do we move that forward, that agenda forward? If you look at Yoga Care, which was the largest yoga-based interventional structured yoga program post MI, over 3,000 patients done in India, it did not improve its primary endpoint. So clinical outcomes did not change. What does that mean? Does that mean you shouldn't do yoga after an MI? No, in my mind. But if you look at other endpoints where you look at, patient satisfaction, quality of life, those things did improve. So are we looking at the right endpoints? A. B, can we try to at least do things in a registry fashion? You can say the clinical trial space is difficult, but let's at least collect data. So there's some systematic approach to what pieces of information you're going to collect from each patient based on a given intervention or multiple interventions for that matter. For example, I very much believe in Reiki and energy work, and it's all anecdotal evidence, right? But if we're going to move the needle, in my opinion, in a meaningful way, we need to start with structured data, A, and B, we need to define a term that people can be comfortable with. And that's tricky. I think integrative is really nice because it offers a little bit more of a broad outlook in the sense that integrative can integrate Western and Eastern. It doesn't have to be or, it is and. And I think that's a nice starting point, at least for me. Different people feel differently about that, though. I don't know. What do you think?
No, I think my key takeaway from this would be defining what is good medicine. I think that's a really nice kind of a title to go ahead and kickstart things, because I think it's also geographical, because there are different places, they have their own belief systems, cultural values, traditions, and different medicines, so different types of medicines like you've enlisted. I think a good starting point would also be doing some research in the area to just collect some raw data about the
Right.
perception awareness, like a cap study, to understand
Mm.
what is the notion about these kind of practices among the general population. And then, like you said, a registry would be like a good thing, which we can kind of follow up on a long-term basis. And as far as the endpoints which you were mentioning, I think quality over quantity. So the things which are good enough and things which are not that good enough in terms of, like you mentioned about the yoga care article. So they said that it didn't improve the outcomes, but what did they actually improve? What was the quality of life that got improved? That's something which goes down, unfortunately. So, kind of bringing that up with such research, I think, is a good next step.
Yeah, absolutely. I think that, getting out of it's always tricky because sometimes it's very financially motivated, right? What are the endpoints? Um, and if it, let's say if it reduces hospitalizations, okay, that's something that is approvable that will lead to, cost efficient care, et cetera. What is super important. And we shouldn't ignore when it improves a sense of well-being and quality of life.
Absolutely. I think more articles as they're coming in, it's specific to quality of life improvement, general well-being. Now we have those palliative centers coming in a big way, which are actually targeting this dimension. But you are a trialist yourself. Coming back a little bit to the research part
Um,
of it,
I'm so sorry to jump in the middle of it. Not to prolong the conversation, but there was this one quick follow-up question I had. Do you think that instead of having one starting point, there should be two starting points we should be focusing on? For example, like Amanpreet had just shared his anecdote with this known person. Do you think we should also be simultaneously be perceiving how the clinicians and the other cardiologists are getting into integrative medicine and having an educational forum for them to make them realize the importance of it as well?
Mhm. Thank you for that question. Personally, I don't, if the intention is to set out to change opinions, it's not gonna, in my opinion, that's not the best use of at least my personal energy. I'd rather spend time aggregating patient experiences, understanding what works, what doesn't, collecting data in a structured way so that I can actually speak to a quote unquote integrative approach. And again, that can mean so many different things to different people. Does that mean that you're getting energy work? Does it mean you're doing an Ayurvedic diet? Does that mean that you're getting physical therapy? Does it mean that you are getting acupuncture? So I think we have to be very careful about saying, no, no, we need to tell you the importance of integrative medicine. And again, this comes back to what can I do? What can I bring to the table? And I think if I can be a part of an effort to collect data in a more structured way, that's a good starting point.
All right. Thank you so
Yeah,
much for that, Dr.
I
Lala.
think that was I completely agree with you because as far as when you're talking about the general perception, I think instead of it being a didactic kind of a conversation in which we are telling them about, okay, this is something which we are going to try, this is something which is also there, we can actually first go ahead and see what do they think about it, have they heard of it, are they aware of it, and then maybe following it up with that might be something which can turn into something meaningful. But yes,
Yeah.
coming back to what we were discussing about the clinical trials, and since we've gone a little astray, coming back to the research and the trials part, I'd say you are a trialist yourself. There are so many landmark trials coming in day in and day out, presented at conferences. There is enough data to support that women are underrepresented in these trials. But why do you feel the underrepresentation, or where does that stem from? Is it just the population, the geography? Is it just the hesitation? Is it the way the clinical trials are designed? Where does that gap stem from?
Yeah, I mean, I think it's such a good question. It's one that we've talked and thought a lot about. Martha Gulati and I have published on underrepresentation of women in clinical trials as well, as so many others have. I think it's partially structural based on eligibility criteria. I think recruitment patterns, right? Where are you recruiting? When are you recruiting? Is it during childcare hours? Is it in a way that allows for women to actually leave their homes and come for clinical trials in a way that's not time consuming? Can we meet patients where they are in the communities, for example? But it's also conceptual because we've historically designed trials around a default patient profile. And so it's very generalized from there unless you're very intentional about enrolling women. Like there have been, when I was a part of the CTSN, which is the Cardiothoracic Surgical Trials Network, which was funded by NHLBI, there was an effort that we contemplated with the NIH to actually incentivize centers to enroll women and other underrepresented groups. And I think that that is really putting your money where your mouth is, so to speak, right? You want to enroll a certain population so that you can better understand them, so that you can better design the future trial based on understanding the women that were women, or for that matter, other underrepresented groups behaved or responded in that first trial. So it's a domino effect. I think upfront, data are not powered for sex differences, right? So there's the inclusion aspect of it, but it also needs to be, again, intended from the beginning to examine sex-specific effects of a given therapy. If that isn't something that you've defined as an a priori analysis, the conclusions are going to be limited. And then it stunts the pipeline moving forward. And all of that translates clinically, I think, into uncertainty. We're often applying data without really recognizing the magnitude of benefit, of whether that magnitude of benefit is the same for women and men. I mean, in this case, we're talking about sex differences, but this is really relevant to any underrepresented group.
Yes, I think that that's really well put because it's also the design which you've spoken about, and with that comes the bias as well. So that tends to move the needle in a direction which is, I would say, pre-decided, and it doesn't kind of cover the entire geography. So, and I think when this initiative was launched and when people came to know about the underrepresentation, you have leading work in this domain, and I think I've also seen a little buzz about women-led trials and people who are actually just being focused on doing that just for women and led by women as well.
Yeah, I mean, there's some data. It's not always consistent,
Hmm.
but there is some data to show that when there is a woman principal investigator or women on the steering committee for a clinical trial, that there is more inclusion of women. That, and it inherently makes sense. So I think that women are typically not seen in those leadership roles with respect to clinical trials, and there's multiple reasons for that too. But the more we see that, I think the more there's going to be that intentionality for sex-specific analyses, for broader inclusion of women. I think, but I'm an optimist, as I shared with you before. So I feel blessed to be on steering committees. I know many women are, and I hope that that trend will continue to improve over time.
Absolutely. Thank you.
Right. Thank you so much for that discussion. I think just the next question is going to be a quick follow-up on what we discussed in the realm of research. Considering a lot of females, even when they are included in these cardiovascular studies, a lot of times when the data is being analyzed, they're not powered sufficiently, or the results which are being produced, they are not significant enough for them to be replicated in the real world scenario. So, personally, in your experience being a clinical trialist that you are yourself, how do you think that we, as not layman people and even the clinicians, should interpret these limitations? And how do you think how much it can be replicated in seeing what the actual scenario is comprising of?
Yeah, I mean, it's a super loaded question, right? It kind of goes back to like what we were discussing. We need to start somewhere. So you got to start by including those women. And there's multiple aspects of that. It's not only on the recruitment side, but it's on the leadership side, because the design, if you say a priori, we're going to enroll 40% women in this study, and we're going to plan XYZ sex specific analyses that need to be powered as such to be able to answer these questions, that intentionality will translate into increased enrollment, which will then lead to better answers. For example, we're doing a part of a women-only study. It's called Roma, that is enrolling women and understanding different bypass surgery strategies. Okay, and women only. And everyone was like, oh my God, you're never going to get enrollment. You're never going to meet your targets. Women are never enrolled in these clinical trials. Enrollment is like double the rate that they thought it would be. Right. And so unless you do it, you won't know. And so I think there is a role for women only trials. You're seeing that. You saw that at ACC with Minoka, for example. Enrollment's not difficult for these studies. So I think that's something also to consider is the intentional study upfront of women alone. That's not such a crazy idea. We have plenty of men alone studies.
Yes, definitely. And I think I remember seeing a similar trial where some twitches were made in the study design, which is the famous the RIA trial, which was headed by Dr. Roxana Mehran. And she also had made a study design in a way that there were only women only for assessing the Tower versus Savo realm, which is an ongoing question forever. But I really hope that in future we have more such researchers where we are able to have study designs dedicated only for females and how it fits into their day-to-day schedule.
Yeah, absolutely.
And you also spoke about, I would say, the representation of women and how it's been pretty overwhelming. I think we experienced that when we launched this initiative. We weren't expecting such a big turnout, and everyone's like, "We want to be a part of this. What is this about?" I think that's also because there is so much that can be done. So many people want to get involved. It's just that they didn't have that forum. There's no platform which exists to kind of do that, and that was one of the motives behind launching the WIC, for not just advocating for women, but also a platform which is common, shared by people
Mm.
without any bias or any specific differences. And for to men as well. I mean, I'm here, so I can say that as well. So that we have that common support and that system to kind of tell people, okay, we are here. If you're interested in doing something, we're happy to help and kind of take it forward as well.
Yeah, amen. And I think that it's so meaningful because it's not just then a benefit to women, it's a benefit to society,
Mhm.
right? Because it's a recognition that there needs to be representation across multiple different strata, right? And again, I'm taking from Swami Vivekananda. I'm not saying the exact quote, but unless women are supported, acknowledged, studied, included, that community cannot rise collectively, right? It's like birds cannot fly with one wing, right? I think is one of the sayings. So I think it in the inclusion study of women, it translates then to multiple other underrepresented groups. And I think that that's what part of the beauty is of this whole endeavor. So kudos to you guys, because I think this is amazing.
Absolutely. Thank you. I just looked up the quote while you were talking, and I think this is going to reiterate for everybody here. So, this is quoted by Swami Vivekananda. There is no chance for the welfare of the world unless the condition of women is improved. It is not possible for a bird to fly on one wing. I think that's a beautiful expression.
There you go.
Absolutely. So moving ahead, I think we've talked so much about, women in trials, about in cardiology. I think specific to what we're doing in India, catering to the South Asian population, we know that South Asians are an enhancing risk factor for CVDs, earlier onset in younger populations, but specific about South Asian women. And I think I can even go even more specific about two groups which come to mind. One being the young people, the younger generation, people like Priyansha, who are leading such initiatives, and the other part being postmenopausal females who are, or maybe elderly aged women who are actually suffering from those diseases. There's this gap of prevention. Everyone's talking about it, but kind of clubbing the two questions that everyone is seeing on the screen, that in your perspective, it's not just the knowledge gaps, but what cultural barriers. There's poor health literacy. There are so many norms people follow in household practices. What would be something which is, according to you, a priority right now for South Asian women in this domain?
Oh, oof, I love this question. I mean, I think, it's funny because we know that the South Asian population in general tends to be affected with respect to cardiometabolic risk earlier on than other populations, first and foremost. And not only is it earlier on, but it's probably to a greater extent as well, right? If we're talking about women in particular, I quite frankly think that this applies to South Asian men as well, but the South Asian population broadly, and the American population for that matter, is how can we mitigate cardio, kidney, liver, metabolic syndrome, period. I think that this new structuring by the American Heart Association is a total game changer. Because when you start, there's primordial prevention, which you all know, of course, but that stage 1 CKM syndrome is, as Milton Packer would call it, angry adipocytes, dysfunctional fat cells. This is that preferential mid-turf deposition of visceral adiposity that we know is all too common in the South Asian population, right? You see actually atrophy in the arms and even legs, but you see midriff adiposity everywhere you turn across the world among South Asians in particular. How can we combat this? Well, first and foremost, I think we need to go basic. Life's essential 8. Our diet and our exercise, critical. The amount of sleep we get. What is our day-to-day routine? I think there are so many things that are inherent to our South Asian culture that unfortunately don't allow for an optimization of those prevention-based lifestyle interventions. And there shouldn't even be interventions. They should be inherent to our lifestyle, period. Are we walking? And this then it goes to society too. Like, where do you walk in India? Like, where are those spaces? And that too for New York as well. I mean, it's relevant really worldwide, but perhaps in a unique way for the South Asian population. So the daily exercise, when you're eating, what you're eating, the fried food, the sweets, the inherent Indian diet or South Asian diet is incredible. It's so varied. They often teach, make your plate look like a rainbow. No cuisine is more set up to do that than Indian cuisine, right? But yet we don't harness its therapeutic potential because we introduce a lot of the fried aspects of things when we're eating, the quantity with which we're eating. So I think the lifestyle is so critical to change, first and foremost. Second, I think so really building awareness around just, I would say, exercise, and that by exercise I mean movement and diet, I think would revolutionize so much of what we seek. Then, of course, there's genetic risk. I think that the cardio kidney metabolic syndrome based drugs, like nonsteroidal MRAs, like SGLT2 inhibitors, like, of course, GLP or incretin based medications. Now we have these three classes that are really proven to mitigate CKM syndrome, are the wave of the future. I think these apply to the South Asian population to a greater extent, perhaps, than the general population, because CKM syndrome afflicts the South Asian population to a greater extent. You can see how passionately I feel about that, because I think that this is, it's a revolution that we're experiencing. And so I'm almost excited about it. It's a matter of making these therapies accessible and complementing them with lifestyle changes.
I think that that's really covered up everything that we kind of wanted you to answer from this question. I think you rightly mentioned about the life's essential eight, the cultural norms, the Indian diet. Of course, it's fantastic. It's just that the imbalance happens in a way, and it's I think it's a common cultural household practice. When the oil gets too much, you don't know which oil. There is so much noise around, so you I think get lost in that misinformation zone. So you don't really know what
Yeah,
is good versus what is right.
right, right.
And I think the concept about the obesity in the South Asian, specific to like the sarcopenic obesity with elderly people, they lose their muscle mass and the fat is also there around the abdomen. But I think that's something which can easily be, I would say, targeted by the therapies which have come up. And I think last month when the patent came off, it's now becoming much more cheaper for people to afford in India as well. So
Unbelievable.
that's something which is I didn't see personally. I didn't think that this would be so cheap to buy in India, but it would be interesting to see how much access do people get out of it. I think the restriction is still there to those hospitals and tertiary care centers. The goal, if we have to, I think, increase it at large, would be to go to the community and kind of do something in that domain. But yes, I think that's covered up everything. So thank you for answering this so beautifully.
Aman, I think to your point, just to piggyback off what you said though, is it can't be those therapies alone. It has
Mhm.
to be coupled with the changes in lifestyle that are needed, you know? And I think, quite frankly, that to me represents integrative medicine. That represents to me
Right.
holistic, right? So it doesn't only have to be what we think of, which is like yoga, pranayam, energy therapies,
Mhm.
whatever you want. It's, are you moving? Are you eating the right amount and the right foods? And are you
Right.
taking your incretin-based therapies? Like
Mhm.
that to me represents true integrative care that's evidence-based.
Right.
And then, of course, there are other things that can be studied in a more systematic fashion, as we talked about.
Absolutely. I think that's the balance to go ahead with this. It should be lifestyle because there is the genetic risk which we cannot like run away from. So we have to kind of, we know that it's high risk population. There are things which are going to be earlier and worse in the population. So
Right.
how do we curb it from number one, the lifestyle, as you mentioned, the health based, the diet, exercise, as you rightly put, how much are you walking? If it isn't like 10,000 also, even if you are doing something which you are conscious about and you're making an active kind of effort, I think that goes along. And then you
Yeah,
have the medicines to help you.
absolutely. Absolutely.
Right. Priyanshi, you'd like to take the next one?
Yeah, thank you so much, Dr. Lala, for sharing that. And I think advocating for these things is something that we also aim to do through this initiative in terms of our educational material and to reach to maximum communities. Before we move on to the next one, I have a quick follow-up questions on the basis of the lifestyle changes that you had mentioned. In our previous session with Dr. Tamrisa, she was very persuasive on mentioning the importance of walking 10K steps daily. So I wanted to know if there is any advice that you always make sure to give to your cardiac patients and which you have personally seen that have definitely improved them in terms of their lifestyle.
Yeah, thanks so much, Priyanka. I have a little bit, of course, I agree. with what Dr. Teresa said, but I also think that we need to meet our patients where they are. I can, I'll dare to say, if you tell the average, like let's say, Indian parent in my parents' group of friends, you need to get 10,000 steps a day, it's going to fall on deaf ears. I promise you that. And then you've lost your connection with your patient. You've lost that opportunity to exchange trust and change their life, their lifestyle. If I don't know if you guys have seen this, but if you haven't, it's worth looking at. The cover of the Lancet has just one quote on it this month. It is small and realistic increases in physical activities for up to 5 minutes a day can prevent up to 6% of all deaths. So now you're meeting somebody right where they are. Listen, 5 minutes can make a difference. 5 minutes. Do you have 5 minutes? Walk up and down the hall. 5 minutes. Don't take the lift. Go up the stairs. So this is this notion of exercise snacks, which is ironic, right? Because you're calling it a snack. But the point is that even these small little increments of exercise make a difference. So while there is this goal, I don't get 10,000 steps a day, but I'm physically fit. I make a point, I try to, but I do different types of exercise, And so now since my mentality has shifted a little bit, being like, oh, every movement counts. There are some studies, and they're a little bit lower quality, even 2 minutes intervals of just squatting by your desk, taking the stairs, walking across the street. It counts. It makes a difference. So the point I would say that has changed in my practice over the past year really has been meeting my patient where they are and helping them recognize that every little bit counts. There's a poem that's little drops of water, little grains of sand help to make the ocean and the pleasant land, meaning every little effort that's put forth makes a difference.
Definitely, and I totally agree with it. I think this is where the whole concept of having personalized advices for your patient comes in. Because if they're able to start at one point, you might be able to accumulate more and more advices, and they would be open to accept it. Starting off in a huge tree might not be something that they would want to start off with. But if you have these small, small advices, they would definitely bring up a huge change. So thank you so much for sharing that, Dr. Lala. I hope that it helps us and all the participants here to also, when they start their own clinical practice, on how they should be approaching their patients.
So baby steps for everyone. Personalized baby
Amen.
steps.
Start somewhere.
Right. Considering we had such an exclusive conversation on this topic about the importance of cardiovascular health in females and where we are today and where research is going on with, I think it's only fair to talk about what we are looking forward to and how this field is gonna evolve. So, Dr. Lala, what do you think are the areas of research which you believe have greatest impact on improving the cardiovascular outcomes for the females and which you think has the most motive in bringing up a change for them?
I think we've talked about a lot of it. I think this awareness around different inflection points in a woman's life as entry points to recognizing their cardiovascular risk is going to be this signature change. And we're already seeing it, right? So pregnancy, you're screened for hypertension, diabetes. Now we recognize that hypertensive disorders of pregnancy increase your risk of heart failure, cardiovascular disease several fold. So this is that first window for a person. And this, I think, is so applicable to a country like India, where you have a captive audience during an important period of time in their life where they want to ensure perhaps a different outcome, which is to have a healthy baby. But this is also an opportunity for them to recognize their own cardiovascular risk. So that's one really important space. I think the second one is one that we've already talked a lot about, which is around this perimenopause, menopause state. and recognizing that as an inflection point for an increase in cardiovascular disease. So if we can start to just use these two inflection points for advocating for prevention, for proactive care, for recognition of risk, that's a game changer for women broadly. And I'm excited about it.
Definitely. I think it will be really interesting to see what the where the future lies for this realm, and hopefully there will be a lot of meaningful change for it. I think one of the major things why we wanted WIC to also focus on research and advocacy was to ensure that even the medical students have an equal opportunity to contribute to the research that goes around, because, they are not someone who stays in constant touch with patients like other clinicians do. But if they are able to conduct on-field activities, and if they are able to have conversations with people who are in a community and these females, and they are able to rely their problems and what they faces, and if we are able to collect this whole data and kind of produce it to evidence, to even to reach out to clinicians and tell them that this is what we have noticed and this is the gap that I think really should be covered. I think that can also be a starting point for just fellow medical students to go around.
Yeah, I completely agree. Earlier we start, the more advocacy, the more awareness there will be.
I think this is on the whole been a very wholesome kind of a session in which we've addressed, I think, the major topics that everyone had on mind with this webinar. And I think the last two questions are actually targeting the thing which has been asked by the most of the people who've been kind of interested in this is being a youth-driven organization. We are young minds, we want to do so much. And what do you think would be, I mean, we are already doing initiatives like this, but if there is a student who wishes to make an impact in this field, not just in women in cardiology, but broadly in research and clinical domains as well, what would that one guidance or one pearl from you be?
I think it's maybe twofold. One is be curious. Be curious. I think in today's world where we are so motivated motivated by external validation, visibility, via social media and other platforms, we are less inclined to look inward and to think about what we're truly interested in, truly attracted to, truly curious by. So I'd say stay curious and think about why you like what you like, because that says a lot about you. Don't pursue something just because it's hot, but something that's interesting to you. Why is it interesting to you? What do you know about it? What do you want to know more about? And I used to not give enough weight to that inner voice. And over time, one of my favorite things about growing older is not caring as much what other people think about me. That's my favorite part of growing older. And so I would say to young people, I would say strengthen your inner voice. And the way you strengthen it is by listening to it. That's number one. And number two would be to recognize that every little bit counts. Just the way we talked about 5 minutes of exercise makes a difference. Every little question makes a difference. You don't have to have an audience of 10,000 people. You don't have to solve dyslipidemia in South Asian populations. These are massive, massive questions, massive endeavors. But you can change the habits of your family. And maybe that will inspire some families around you. And maybe that will inspire a community. And maybe that will lead to change on a systemic level for your district or region or whatever that is. My point is that recognize that change happens one step at a time, and every step is meaningful. So don't get overwhelmed by the need to have grandiose movements or massive change at once. We talked a little bit about this in our editors page last month at JCF, and I can send you the link. But we think about our purpose in life a lot, like what's my purpose, especially as a young person. But I think that way too. Is what is my purpose? What am I doing here on this earth? And you want it to be something large and something that people can look to and say, oh, that's her purpose. That's this. But our purpose is really in the little things that we do every day, right? The purpose is how we talk. Our purpose is how do we talk to each other? How do we interact with others? Um, so I think purpose can be found, meaning can be found in little things. And so as a young person, I would tell my younger self is don't be too concerned with making it so big. Recognize that it's the tiny steps that lead to big change over time.
I think that's beautifully expressed, and it's so inspiring because I think most of us on this, I would say, this meeting and the people who will hear it after the recording is done are early career people, are the youth of tomorrow. So I think this is something which resonates so much, which what I've been doing myself personally as well, because like you said, the idea is not that grandiosity. It's being the small things, one thing at a time, the little things. So for us, even today, it's quite fulfilling that we could get the webinar done, could get a good audience to hear you and to have that share of communication. So thank you. And I think this is a good kind of a takeaway for most of us. Great. So I think those are most of the questions that we had planned. And now I think, Priyanshu, you can open it to the people who are interested. If there's have any questions, we'll be happy to answer them.
Yes,
If
sure.
there's
If
anybody,
anyone,
yeah.
if there's anyone who wants to have a question, you guys are free to unmute yourself or even type in the chats.
Hello, Dr. Lala. Good morning.
Hi.
I'm Padmasini. I'm a recent graduate. And since you were talking about meeting people where they are, a question popped up in my head. How do we create awareness by, breaking the colloquial language barriers and teach women or create awareness about heart dysfunction or their health in general, who basically tend to ignore their health? Like, how do we do that?
Whew. Yeah. I think, there's a class I'm taking actually on motivational interviewing. I think first recognizing meeting a patient, when we talk about meeting a patient where they are, oftentimes it doesn't start, especially women who are so preoccupied with taking care of others in the South Asian communities in particular, right? How are my children? How are my parents? How are my siblings? What's for dinner? What am I? So if you go to them like, oh, but your heart is sick, it's kind of like, okay, I'll deal with that later. That's a secondary issue. So asking them what means the most to them and understanding what their reason for living is, so to speak, is a nice starting point that I have found helpful. And when you recognize and learn what their starting point is, oftentimes I find that it's living for others. When you place the importance of their physical and mental well-being in the context of being able to serve the ones they love, they tend to receive the information in a better way. This is more anecdotal than anything else, but that has been something that's been helpful for me.
Yeah, that answers my question pretty much. Yeah, that's something I should inculcate, and yeah, I'll try doing that from now on.
Yeah, and let me know how it works. At least for me, it's proven to be helpful.
Yeah, I like that perspective of yours. Thank you.
Thank you.
Great. Is there anyone else who has a question or anything in mind? While we're waiting for that, so someone has texted me asking, and this is it's a similar question what was asked to Dr. Tamarisa as well. How can men help in initiatives like this, advocating for women in such initiatives? That's a question we, I think, had last session as well.
I love that question because this is not just about women advocating for women, right? It's a societal issue. Just like we talked about, I think we already kind of beautifully touched upon that quote, is that when we ensure that all members of society are uplifted, the whole society is uplifted. It's all boats rise with rising tides. And so men, by being here, by being a part of the conversation, by showing up for female colleagues that are at work, by advocating for maternity leave that is equitable while women are working, for example, this is just one example, it's a life-changing sense of support. Because then it's not women fighting for women, it's society fighting for society. And so I think just by showing up, by recognizing that by advocating for women, the study of women, women in professional realms, you're standing up for your mom, for your sister, for your daughter, right? And I think there's nothing more powerful than that.
Great. I think that's a very well put answer, because these are just small steps that everyone can take, I think, from at home to at work. And I think that, like the saying goes, that behind every successful man, there is a woman. And I think that stands pretty true in both personal and professional lives. And another thing, since we're talking about integrative well-being and, the purpose of life, I was actually quite impressed by an article that I was reading. And the title of the article was The Role of a Partner in Well-Being. And that is something which was pretty interesting, because I haven't thought of it about in that dimension in terms of the whole complete well-being. Do you have any take on that, or what role that might play?
Oh my gosh. I mean, I don't think it's an essential, but I think if you're lucky enough to have it, boy, it's amazing. My partner plays a huge role in my well-being. Hopefully he won't listen to this, so it won't go to his head. But we met in medical school, and I would say he's my biggest cheerleader. He's the reason that I am outward facing. He's the reason I attend conferences. He's the reason I've sought to, um, you know, move forward in my career. So I think a partner can have a profound impact on your well-being. But it's important to recognize that that's not something that you need to be in search of, so to speak, to complete you, but rather it's how can you facilitate growth for one another? How can you be each other's cheerleader? I would like to think that I'm also his biggest cheerleader, right? So it's a give and take, and it's truly beautiful when you can find it, because it potentiates each other's energy. If you seek it from that perspective, not like, what are you doing for me, but how can we help each other rise? How can we help each other shine our brightest? Then there's nothing like it. I think it's a real blessing.
Right. Thank you so much. I think, these are topics which people don't usually talk about or discuss when they meet. And I'm glad that we have this platform so that we can at least address such issues or such topics which people really don't think about in their normal lives. And life just goes on. And I think the last question that just popped up is, Dr. Lala, you talked about purpose. How do we find our purpose? That's someone's question.
Yeah, that's like the meaning of life, right? Um, I still wonder this all the time. It's a question I ask myself all the time. I want to reiterate what we just spoke about, which is that we're always thinking that it has to be something grand, but rather meaning and purpose are found in the little things that we do on a day-to-day basis. I think I just got asked this by the fellows at Mount Sinai when I did a session with them. It's called Matters of the Heart. And I did this a couple of weeks ago. And we were talking about, the question was, how do I take advantage of the fellowship? And then I said, think about your purpose, think about the meaning that you're seeking to deliver, contribute to. And then someone said, but how do you know what you like? Which is kind of the same question in a way. And I think sometimes I'm just sharing things that have helped me, that are helping me, because this is an ongoing quest for me as well, is I think I try to take note of the things that I'm grateful for at the end of the day. So as a practice, as a ritual. So I do this with my kids. We do our 3 thank yous. So what are the 3 things you're grateful for today? And we all go around the table, or we do it before we sleep. And over a period of time, when you take inventory in a systematic way like that, it's like collecting data, you start to recognize, okay, what are the things that I am intrinsically, what do I value most? So, when I was younger, earlier in my career, I was like, I want this paper, I want to publish this, or I want to achieve this rank, or, and when some of those accomplishments would happen, they would be one of my thank yous, but it was rare that it would be all 3 of them, or even 2 out of the 3. The 2 out of the 3, or sometimes 3 out of the 3, were always about human connection, family, friends, loved ones, feelings of oneness in general. And so I started to recognize that, okay, this is something that's inherently something very important to me. And when you start to, it tells you more about yourself. Like, keep a watch, or be a witness, be a sakshi to what you like. Who do you admire and why? What books do you like? What songs do you like? What teachers do you like? What patient interactions mean the most to you? When you start to take inventory of that, you start to realize who you are, what matters to you as a person. And it helps understand yourself. That's one part of it, I'd say. The second part of it is, or the flip side to that is, sometimes it's about, I don't want to do this, I don't want to do that, I don't want to do this, I don't want to do that, because you also want to take inventory of the things that you find inherently energy depleting. For me, for example, when I was studying nuclear medicine, nuclear cardiology, I did not find it rewarding. So even though everybody was getting nuclear boarded at that time, I was like, that's not for me. I don't want to do this. And I didn't do it. And so sometimes the purpose is from chiseling a stone over periods of time to allow for the sculpture to unfold itself. So I think that there's no one quick fix to finding the meaning and purpose to your life. I think you have meaning and purpose on a day-to-day basis. Doing this webinar today is a part of the meaning and purpose of my life today. And being present is really important for that to have meaning and purpose today. And so it's a long-winded answer to a complicated question. I would say it's a combination of not thinking that it needs to be super grand for your entire life at once. Take inventory of what you like, value, and what you don't like. And over time, cater to the things that are energy giving rather than energy depleting based on your personality and your value system. Those are the 3 tools that I use.
I think that's really very inspiring. I think I'm better off as an attendee to this webinar than a host. But I think you've really beautifully kind of sewn everything together, because I agree with you. There's so much noise around. Everyone wants to do everything. What's the next hot topic in cardiology, in medicine? Everyone wants to publish papers, and it's becoming competitive. It's true, I understand. But like you also said, that you have to carve that stone, that path your way. What do you find meaningful? That's can be just one coin in your pocket as you go ahead, one feather in your cap as you go ahead. It need not be so grandeur. And being grateful is, I think, the cherry on the cake of being immersive and kind of that integrative well-being that we've been kind of talking about. Because I think those small things matter more than the big ones, because those are which persist, and the big ones actually come and go. And I think we shouldn't get too much fixated. And I think I've become too spiritual on this conversation right now. But I'll just take a last quick question that is put up with somebody. And they said that as a student, I'm still doing my MBBS, and cardiology always felt both inspiring and intimidating. In moments when the science is clear, but the patient's reality is complex, how do you decide what kind of a doctor you would want to be in that moment? Like, how do you take that decision?
How do you decide which kind of specialty to pursue? Sorry, I got distracted by another question in the chat, so I thought you were reading that. Forgive me.
Right. No, it says in moments when the science is clear, but the patient's reality is complex. I'm not too sure about what kind of reality the person is talking about, but the question is, how do you decide what kind of a doctor you want to be? Is it, I think, going to be an overview or very personalized in that answer as far as the treatment is concerned?
Again, I think it's meeting the person where they are. What are they ready to embrace and why? And are they motivated to do it? So sometimes it's about asking more questions than it is telling them what to do. And I'm guilty of doing the latter. I was in clinic yesterday. I'm going to be in clinic in an hour. Sometimes we're like, oh, you have to take this, you have to take your statin, you have to do strength training, you have to do da, 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 da. But if that patient's not listening to you or not in a space of receptivity, it's a waste of your energy and theirs. So sometimes just starting the session off with, what are you looking to get out of today's visit? That's a good, thank you. You guys are reminding me of things that I'm going to take to clinic in just an hour as well, right? What are you seeking here? And make sure that you're aligned on that intention to start. And then you can also meet each other, or you're really meeting them where they're starting or where they're looking to be helped. Rather than just going down a litany of different tests that need to get done and different drugs that they need to take.
Absolutely. I think that's the key takeaway as well, that you meet the patient where they are, in what kind of a setting and situation, and then cater accordingly. But yes, I think it's a lot for people to understand. It takes time, especially people who are young and who are getting into the careers like us. But I just wanted to thank you. I was really anxious at the start, and I'm much, much at peace right now. So thank you for that. It's been a wonderful
Did I make
session.
you
This was
anxious?
our no. The whole thing about the coordinating the meeting and everything,
Yeah, yeah, yeah,
it can get complex. But I think we are all at much peace right now, and I think it's a really nice thing, because this was our second inaugural webinar, and we were able to do this and get the word out to people. I think we've done a lot in this. So this was one small thing that we are grateful for today, and grateful that you
Oh,
could have
nice.
joined us and kind of shared whatever you could share, and it's really beautiful whatever you shared. Thank you.
Thank you, thank you. Thank you for having me, and really looking forward to seeing what this organization is able to accomplish.
Absolutely. And I think Priyansha is the lead on this, and we'll soon be having our board meetings with the women in cardiology and a lot of things which are coming up, a packed national project, but this is a good start.
Amen. Thank you. I am
Yes.
also running the clinic, so really grateful for this opportunity, and thanks for everybody's time and attention.
Absolutely. Thank